Welcome to the HR Kyle podcast, your go-to source for insightful discussions on leadership, job searching, and all things human resources. I'm your host, HR Kyle, and each week we dive deep into topics relevant to professionals seeking to elevate their careers and organizations. Whether you're a seasoned leader, a job seeker navigating the ever-changing landscape of employment, or an enthusiast looking to stay ahead of the curve, this is the podcast for you. Join me as we explore practical strategies, share expert insights, and engage in meaningful conversations that empower you to succeed in today's dynamic workplace. So, adjust your headphones and let's dive in. Hello and welcome to another edition of the HR Kyle podcast, and I'm your host, HR Kyle. Today's topic is one that I think too often gets overlooked by employees, and that is making the most of your benefit offering, right? So not only making sure that it fully fits your needs as the employee, but also fully fits your needs of your family or the needs of your family. So really understanding that. So that's what we're going to be talking about today, Becki and I, in segment 1. And then in segment 2, we've got an individual who has a very unique business, and where she focuses is on working with individuals, employees of organizations, to be sure that they're adequately and completely using their benefits, and just as importantly, advocating effectively on behalf of their loved ones. So this is a little different topics than maybe what we might typically cover, but it's something that we wanted to be sure that we got on the list of things that we've talked about this year. So stay tuned. We're going to take a quick break, and when we're back, we'll get right into the topic. Hello, fellow professionals. Are you ready to revolutionize your approach to recruiting? I'm HR Kyle, and I'm thrilled to introduce you to my latest book, Recruiting is Easy, now available on Amazon and other online retailers. In today's dynamic HR landscape, it's all about strategic branding and engagement. My book unveils the secrets to crafting exceptional employee experiences, attracting top talent, and fostering strong connections. With Recruiting is Easy, you'll master the art of continuous improvement and adaptability, shaping the future of work one relationship at a time. Get your copy today and unlock the potential of HR as a strategic powerhouse. Remember, recruiting should be easy. I'm HR Kyle, and together, let's redefine recruiting. Look for Recruiting is Easy on Amazon and other book online retailers. And we're back. I hope you enjoyed that brief break. And for segment 1, as usual, HR Kyle Becki will be joining me, and she'll be in charge. So HR Kyle Becki, take it away.
Hi, Kyle. Thanks. This is an interesting topic, and again, one that we probably don't really discuss too much. So good job on the selection of this topic, and here we go.
Okay.
So we're going to kind of just start, advocating for yourself and your loved ones. So we have to remember that it is about you, but it's also your family, your people that you have with your healthcare needs as well. So what are the most effective ways that we as employees can advocate for our healthcare and the needs of our family members?
Well, I think the first thing is don't be so hasty to make those benefit elections. When your organization, either at the time of hire and then, of course, as we go through open enrollment, provides you information, be sure to take that information home and talk with your spouse and significant other about all of your family's healthcare needs. And what I'm speaking specifically there is, typical use of medical benefits, dental benefits, and vision benefits, any sort of prescriptions that you're using, and how those needs might be changing in the year ahead. So really taking a good hard look at how you're going to need these benefits and how you're going to potentially use them in the coming year, rather than just look at the list and then make some elections and go forward. You want to become a more conscious shopper, much like we do when we're thinking about the week ahead and we're doing our grocery list. We're making sure that what we want to eat in the upcoming week, all the ingredients are on the grocery list. So it's the same way with your benefits. what are you looking ahead at in the upcoming year, and what does that mean relative to what you will need for benefit coverage?
Right. I think that's perfect way of saying it. And then what makes me think of first are younger people. Younger people, starting in the work world, they don't really know what to do. Ask your parents, ask grandparents, ask older people, what do you need? What should I have? For example, short-term, long-term disability. That's probably not something that people in their 20s and 30s are thinking of.
hmm Very true. And especially if they've been up to that point, they've been on the parents' benefits, they don't necessarily think about how they use them. They just know they need to go to the doctor at a point, and they make those appointments. But the parent can say, well, hey, let's talk through this a little bit. You know what? You've got these allergies. Uh, 4 times a year, you have to go to the doctor for this reason. You want to have your typical, two cleanings, but remember too, you're still wearing braces, so you need some work on that. So it's sitting down and talking with them to say, really to understand, I should say, how have I been using my benefits, and what does that all mean? Because you're right, as a younger person, you've not had to deal with that. Your parents have taken care of it. They schedule the appointment, they send you with a benefits card, and that's all you know.
Right.
But you don't think about how you use those benefits and what that means in your selection process.
Right, even just glasses. If you wear maybe contacts more than glasses, because the contacts, glasses you can see every day, you wear them, but that's probably again not something that younger people are thinking about when they're getting insurance.
Well, great point. And the other thing to think about with that is if there's a certain sequence that they allow you to get new lenses and so on, it may not make sense to have vision benefits every year. You may want to just elect those every other year, for example.
Right, and that's a great point because with my glasses and contacts, it's every 2 years. And so every 2 years, I can get new glasses, get new contacts. I can't get both. So I have to choose, which one I want and then over the next 2 years.
Exactly. So again, it's thinking about your usage and how the plans correspond with that.
Yeah, those are great thoughts. Yes. So let's talk about the family coverage. How can, again, we as employees evaluate and compare family coverage options into choosing the best plan for it? It kind of goes along with what you would say, we're saying, but again, this is more of a family type plan.
Well, I think as families, you really have to anticipate what your children especially are going to need as they reach certain milestones. We know when kids reach, 10, 11, 12 years old, that might be the time that braces are going to be a factor. So you start planning for that. Some of the immunizations, some of the other care, and right down to, and I've talked to many more women than men, if they're considering having a child in the upcoming year. Well, maybe they need to put some money in a flexible spending account and think about how that's going to be used. Or, the other side is they know they're going to need or want some major dental work. Again, if you have a flexible spending account, you're charting out what that would amount to as far as the contribution, so you can take full advantage of that. So it really is looking ahead and saying, if it's a milestone for your child, what could that mean? If they're starting school, there's the good chance that they're going to need to take more trips to the doctor because of injuries or other things that they get hurt. If they're going to start playing sports, they may need to get regular checkups and so on for that, so they can be cleared to play sports. So it's really thinking about what your lifestyle looks like, some of the habits, some of the things that, again, might be milestones that are coming up, where you need to build that into the coverage you select.
Right. And the sports is the first thing I thought of because of the amount of times parents have to take their kids, probably again about that 8, 9 year old time period
Yep.
when they have to take their kids for physicals as well as just injuries at least once or twice a year.
Well, and another one I think of too, and you're exactly right, for the physicals, is glasses. The child starts school, they're in school for a couple of years, all of a sudden it's been determined that they need glasses. And I ran into that. First couple of years, my son didn't need glasses, but after being in the classroom for a little bit, it was determined, well, you know what? He needs to be wearing glasses. Now, that wouldn't have been as much of a decision point until he started school.
Well, let's move in then to the other side too, and this is something that you and I have both dealt with, or I'm kind of dealing with now. But practical steps employees can take to navigate health care when managing not just their children, but elderly parents or other dependents that might be ill, might be getting their 50s and 60s and coming up with some different illnesses?
Well, the first thing to think about when these topics come up is FMLA, Family Medical Leave Act. And what that is in essence, and it hasn't been around all that long, just a little bit over 30 years, is it is a provision that has been built into federal law that enables employees who are a caretaker of someone in their family to be granted time off work, and it's up to 12 weeks, so they can provide care to that particular individual. And the key point is their job is protected. So if you're a person that's heading into that, or you might be anticipating that you will need that, start doing your research now. Talk to your employer, understand what that looks like and the things that you need to do. Be sure also that you talk to your loved one's doctor and make it clear to them what that can possibly mean. And again, doctors' offices, they work with this quite a bit. So when you bring up the topic of family medical leave, that's something they're going to be very comfortable with. So they can talk you through as well as what they need to do, how the process works, what forms need to be completed. But definitely talk with your employer to be sure you understand what their process is, who handles it, where should I get the forms from, where should I send them back to. So that's one of the bigger ones is family medical leave. But the other thing that I would ask you to do is make sure you understand the full benefit offering you have. And there's one that I'm thinking of specifically called EAP, and it stands for Employee Assistance Program. And what those are, they're additional benefits, and a lot of companies offer them, but employees don't know that they have this benefit. And what it is, it provides you access to resources that can help you through common life situations. And obviously a couple that would come into play here that we're referring to would be childcare, when you've not had to prepare for that before, you need to make a change, and elder care, and especially specific situations. So this is a resource, again, that's provided to a lot of employees, and they're not aware of it. So if you're listening now and you think, gosh, I've got some challenges I'm going through, check with your employer to see if they offer an employee assistance program. And again, you can take advantage of it, make a phone call. The employer doesn't even know you're doing it because this is all outsourced. It's typically sponsored through your benefits plan, but most commonly your medical plan. Again, any number of different topics and issues and concerns can be taken to your EAP, and they can help you navigate that. And not the least of which are these medical things that we're speaking about.
Right, and great point. And folks, you got to research that stuff. So the FMLA, just to make sure, Kyle, just because you have FMLA, it guarantees your job, but not the exact same job. Is that correct?
Yeah, there's some stipulations that are built in there relative to maintaining your job, and you have obligations as an employee, so make sure that you understand those. Obviously, there are limitations on time. I mentioned that 12 weeks. The other thing is it does go through a review process. So make sure you've got all your ducks in a row. So when you submit the information, it's obvious that you are needed to provide this care. You know, it's not a case of where you just ask for it and it's automatically granted. There are things that you need to do as an employee. You have deadlines on that, and those are well spelled out. But I think to your point, do your research before you need it, if you can anticipate that. Again, do the research online. There's a lot of information online. Talk to your employer. Find out what they have available. Some employers actually have taken FMLA and they enhance it. So they have leave programs that they've built in to their policies and procedures that actually go above and beyond FMLA.
Interesting.
The other thing that you mentioned is, see if there are other benefits offerings that can make FMLA more palatable. One of them really is critical is vacation time. So FMLA protects your job, but you don't get paid when you're using FMLA. So the only way that you can recoup those monies that you've lost in salary would be using your vacation, for example. So again, this is why you're asking the questions, you're planning ahead. So if you know you're going to need to be off 3 weeks to care for a loved one, well, guess what? You saved up 3 weeks of vacation, and you can use that 3 weeks to cover the salary you've lost.
That's great to know. I wanted to touch on one other point because I've experienced this with HIPAA laws, and folks, again, I don't think people are aware of this. Many probably are not, but just because your child is 18 and they're in college, and you have the right, you can access their medical records, different things that need to happen, simply by the young adult writing a letter making you that person that can also, or giving written approval somehow, because I experienced that, and they don't tell you that.
Oh, absolutely. Yeah. Or you don't think about it when you're signing up with your physician or what have you, that you can't have others involved in that decision making. Again, I encourage it for the young employee. Still be a part of the process, but listen to your parent and how they're navigating it. So after that first time, then you're better educated and you can handle it for yourself. So it's not about creating a crutch, right, as much as a little bit of scaffolding around you, so you can understand and navigate these new situations effectively. But again, eventually being able to take it over for yourself. Exactly. And the same holds true on the other side, that if you're caring for a parent, that they provided power of attorney, and they've provided the free use of information by your loved one so they can act on your behalf. So yeah, again, you're taking these steps though before they're needed. So when your child is an adult and they're signing up for a new physician, they're letting that physician know, well, also my mom, right, can have access to information and make decisions on my behalf.
Yep, exactly. Well, great conversation, but let's finish up here today about handling those medical challenges. So when a family member faces a serious health issue, how can employees effectively coordinate with the health care, the insurance employers, to ensure that the best possible care is being taken care of while also balancing those work responsibilities?
Well, again, have the information available to you. Know the phone numbers that you need to call, and if there's specific people that are to guide you through this situation, have that information, have the names, have the phone numbers, determine their schedules when they work, determine when you can call and when you can't call. Some doctor's offices, for example, are closed from noon to 1, or they're not open on Thursdays. So become well versed on that information. Talk to your corporate HR, specifically who handles the benefits, so you understand how those things work and the forms you need to submit and when they need to be submitted and who you should call if you have questions. And if it's not your corporate HR department, it's a benefits broker or someone else that you should be calling, find out who that person is. What's their phone number so you can get through to them. So there's work on your side of getting information to make this a more efficient process. And a little bit of work up front will save you a lot of time and aggravation down the line.
Yep, exactly. Great conversation again, Kyle.
Thank you.
Appreciate you having me here.
Nope, happy to take this on. Again, it's one of those that people overlook until they're in the midst of it, and then they don't know where to go next. And I think we provided some good resources, some good guidance around this. So, listener, if you're out there and this is something you encounter, at least you've got a good starting point of where you need to go. Well, with that, we're wrapping up segment 1. We're going to take a quick break. And when we come back, we're going to be talking to someone who has a great deal of expertise around this topic, specifically healthcare advocacy for your family. So hang tight, stick with us, and we'll be right back.
Are you stuck in a job you hate? Dreaming of a career that excites you? It's time to turn those dreams into reality with Get the Job You Love by Kyle Patrick Smith, also known as HR Kyle. Discover proven strategies to land your dream job, master interviews, and stand out from the crowd. Packed with expert advice and practical tips, Get the Job You Love is your ultimate guide to career success. Available now on Amazon and other online retailers. Don't wait. Start your journey to a fulfilling career today. Get the job you love, because you deserve a job you love.
Greetings, I'm Kyle Smith, and I'm here to offer you a speaking experience that goes beyond the ordinary. With a rich background in leadership, HR, and personal development, I bring a unique blend of expertise and passion to every presentation. Whether it's Leadership Unleashed, well-being at work, or career mastery, I delve into topics that empower individuals and organizations to reach their fullest potential. What sets me apart? Proven expertise, an engaging delivery style, and actionable insights that drive positive change. But here's the kicker. I don't just offer a one-size-fits-all approach. I customize my content to meet the specific needs and goals of your event. So let's elevate your event together. Contact me now to reserve your date and unlock the full potential of your audience and organization. Don't miss out on the opportunity to inspire greatness. Visit hrkyle.com today. Welcome back to the HR Kyle podcast and segment 2 of this episode, where we continue to talk about this subject of navigating the healthcare system. And we know it's a hot topic in a lot of different circles, not the least of which with employees. But beyond that, we know we've got what we often hear called the sandwich generation. And that's those of us who have gotten old enough that we're now providing some level of care to a parent or a loved one. So this second segment is certainly going to talk about navigating the healthcare system. But I've got an expert that's joining me today who's going to talk about this also from the standpoint of being a patient advocate. And her name is Dr. Gerda Maissel. And she's got a lot of things that she's been up to over the years, and she's got a wonderful organization that she founded a few years ago to help those of us who fall into that sandwich generation and trying to navigate this healthcare system, not just for ourselves, but for others. So Gerda, welcome to the HR Kyle podcast.
Thanks, Kyle. I appreciate you having me.
It's a pleasure to have you. So first off, again, I didn't do, by any means, did not do you justice in the introduction. So would you mind taking a couple of minutes to tell us a little bit more about yourself?
Sure. Well, by background, I'm a physician. I'm a physical medicine and rehabilitation physician, which means I spend a lot of time helping people recover after serious injury or illness, often with serious problems like spinal cord injury, head injury, stroke, MS, Parkinson's, things like that. And after working for a while as a physician, I got pulled into leadership, went into health system leadership and worked at high levels within several different health systems. And then during the pandemic, I took a look at what I was doing and decided that I really wanted to take my business and clinical knowledge, combine it, and go back to helping people. I saw so much suffering, so many families getting lost, getting angry, having terrible experiences. And I thought, I can help these folks. And so I founded my MD Advisor almost 4 years ago, and it's been a wonderful experience.
Well, and I can speak firsthand to the fact that you are a godsend to a lot of us out there who have cared for a loved one, but have no idea how to navigate the healthcare system. And you're one of those people who, as you've said, not only have you been a doctor and a physician in these health systems, but you've also been a leader. So if there's anybody that knows their way around, so to speak, and knows the language and how to translate it into something that the average everyday person understands, that's certainly you.
Thanks, yeah. And, when I founded my MD Advisor, I really wanted to address some gaps that I saw in the healthcare system. I saw people really struggling to have a good experience. I saw what I call hidden economic drivers. So, for example, in the hospital, if let's say, God forbid, your mom's in the hospital, there's often a lot of pressure to get mom out of there. And the reason that there's pressure is the way that hospitals are paid. Hospitals are paid a case rate, for example. And so they get the same amount of money, and I'm exaggerating slightly, but whether the patient is there 3 days or 13 days. So there's a hidden economic driver that makes hospitals need to turn over beds. And if you don't know that, it can be very confusing and confounding when all of a sudden that nice case manager is really pressuring you to pick a rehab facility for your mother and you feel like you don't have enough time to figure it out. So I wanted to address some of those things, and I wanted to relieve family suffering. As a physician, I was really aware of patient suffering, but as I do this work, I've really become much more aware and just much more compassionate for what family members go through when they have an ill loved one who needs to get through the healthcare system.
Well, and Gerda, I guarantee you there are a lot of people whose eyes just got wide open based upon just one piece of information you shared there. And that's the fact that it's about bed turnover, that the hospital's making the same amount of money, as you said, from 3 days versus 13. So it's in their best interest from a revenue standpoint to keep those stays as short as possible so they can do just like a restaurant does and turn those tables over so they can make more money.
That's exactly right.
And I'm also struck by something you said, too, and just the contrast at the beginning of that response to the end. You mentioned about having a good experience and how so many people have they're just hoping to avoid a bad experience. I don't know if there's too many of us that when we think about even for our own medical care, let alone for someone else, that we ever imagine it being a good experience. Sometimes the best we can hope for is that it's not a bad experience. But you're someone that's saying, hey, with the right knowledge, with the right guidance, with the right direction that you're able to offer, it can in fact be a good experience.
I do my best.
Well, I know you do. One thing we haven't talked about just yet, but it's got to be so important in what you do. And I want to ask you this. How does poor communication and lack of coordination within the healthcare systems impact patient outcomes? And more importantly, what strategies do you employ to address these kind of challenges?
Well, that's a big question, but it's an important one because there's an enormous impact. I mean, how many times have you taken your mother or even yourself to the doctor and another doctor, maybe a week later, orders the same tests that the first doctor ordered because they don't have the results and they can't get them? Or the two doctors or three or five or six doctors don't talk to each other and suddenly grandma's on 30 different medications, many of which interact with each other. People end up in emergency rooms. They have falls because care is not coordinated adequately and people have bad outcomes. And so many of my clients are frustrated about physicians not communicating. And part of what's behind that is physicians have very, very little time to spend with their individual patients. And there's lots of reasons beyond the scope of this, but one of the strategies that I recommend, what I do with my clients is we prep for every doctor appointment so that not only does the person going into a doctor's appointment know why they're going, but has information at their fingertips that the doctor themselves is likely to need. Many people assume that, well, it's in the chart, so of course the doctor read it. Well, if you think about it, if that doctor has 10 or 15 minutes to spend with you, and that includes the time to read your chart, remind themselves who you are, talk to you, and write your note, there's no way they're going to have every relevant piece of information at the forefront of their mind. So simply by prepping for appointments and having, whether it's tests or history or context, so that you can provide it accurately to the doctor, it can help you help yourself get, if you can bring, for example, information. Oh, I went to see Dr. X last week and he already ordered those tests and here's the portal they're in. While we're in here, do you think perhaps someone could go pull them for you instead of you having to repeat them? There's so many little things that you can do if you are precise enough that make it easier for the physician to meet your needs.
Well, and I think many of us can relate exactly to what you're talking about. You go into a doctor's appointment, you wait and wait and wait. Typically, they're running behind. and then you hear the doctor grab your file out of the bin that's outside the examination room that you're in, and they're pulling that out and looking at it as they're walking into the room. And I can only imagine if it's an older person who has several different medical issues, there's no way that they have time to do a complete review in the 15 to 30 seconds that it took. Gerda, do you often think that from a patient standpoint that, maybe we're 50, 60 years or more behind? And what I mean by that is, as patients, we still live back in the time when there was the family doctor and they came to your home and they knew everybody in the family and they knew you for years and they knew all the conditions you had and so on. But yet the world we live in now, the doctor doesn't have that luxury. The medical system isn't set up for that. And as patients, we need to get 50 to 60 years current on some of the practices that we do. It sounds like that's what you're describing.
Well, to some extent, and a perfect example of that is the family doctor always used to see you when you were in the hospital. So that family doctor knew that if you complained of pain, you better take it really seriously because you never complained. Versus if somebody else complained, they've been talking about that for years. In the hospital, because the hospitalist, the doctor that takes care of you there, doesn't know the human being in the bed, they don't have the context to judge whether that complaint is a really big deal and they should order a ton of tests or not such a big deal. And so as a result, the care is often not as tailored, not as customized to the human being in the hospital bed.
Well, Gerda, I'm going to date myself here a little bit, but you may remember this movie as well, the movie Doc Hollywood. And for those who aren't familiar with that movie, the basic premise is that a young doctor has a car accident. He's forced to stay in this city for a period of time. As part of his punishment for having a car accident, he's forced to volunteer at the local hospital. And as part of this scenario, there's a doctor who's been, like we've been describing, he's the family doctor. He's been there for a number of years. And what the young doctor learns is exactly, Gerda, what you described, right? That every patient has their own unique situation and you don't go by the book because each situation requires its own handling and so on. And the only way that you would ever know that is if you know this person's family history and their life history. And it sounds like that's what you're describing, except now we've got to be that advocate for ourselves to where we understand and know and talk about our own health histories.
Yeah, I call that missing the person in front of you. I write a blog called The Fog Light, which is free if anybody's interested. I write about the healthcare system, and it's available on Substack. You just have to go onto Substack and Google The Fog Light or Google my name, Gerda Maissel, and you can subscribe to it. And I've now written twice on themes about doctors, well-meaning doctors, missing the patient in front of them. And sometimes it feels awful to the patient, but the other reality is it can feel really bad for the doctors themselves because they realize they're not always able to think as deeply about a person, and it's frustrating for them.
Well, folks, we're talking to Dr. Gerda Maissel. She is, among many things, a private patient advocate. She's been a physician now for a number of years. However, she started very young. I want to make that clear. But she's been a physician for a number of years, and she's been a health system leader as well. And we could probably talk, and Gerda, you and I offline said we could probably develop an hour podcast around this topic. Unfortunately, we don't have that luxury. So I'll say in the last couple of minutes, what are some common misconceptions that you know that patients have about navigating their own health care? And how do you help them overcome these challenges to ensure they receive the best possible care? Because ultimately, that's what we're after.
Well, a couple of things. One thing that I see people often doing is when they have something that's significant but not immediately urgent, they assume that if they've gotten one opinion, that that's the answer. And the reality is that you can take the exact same problem, to two different doctors and get significantly different advice. And so if you're considering a surgery or even a medical treatment where you have a little time to think about it, consider seeing more than one of the same specialist and educating yourself before you go in, and then listening very carefully to what is said and why. And you will find that not only are you going to learn a lot, but that you're going to be able to find the doctor that's the best fit for you. It's that you're not always going to get the same opinion or information from a doctor, two doctors of the same specialty. So that's one thing I encourage. And people say, well, what if insurance doesn't cover it? And my reaction is, I do understand that, and I wish insurance always covered second opinions. But if you think about it, if we spend a couple $100 on football tickets or on a Taylor Swift concert, if this is an important part of your life, your health, it might be worth paying for it if you have to. So that's one thing. Another thing is when you go to the doctor, don't be afraid to ask questions. Ask not only what happens if you take their advice, but you can also ask, well, if I choose to do nothing, doctor, if I don't follow this treatment, what are my risks? What might happen? Because we as doctors, we're trained. Oh, you have a symptom? Here's a medication. Take this. And sometimes the best thing is to do nothing, is to not necessarily take that medication. So you want to understand and get all the information you need before you make a decision. And the last one that I'll mention is that many people don't think about elder care and assume that when a person needs long-term care, nursing home care, or care in the home, that Medicare is going to pay for it. And the reality is that Medicare pays for a few weeks. They pay for rehab. You might get a couple of months in certain settings. But after that point, you have to pay for it. And people are often angry and shocked when they realize that Medicare does not cover needed health care in the long run for people who are stable.
Wonderful advice. And folks listening out there, again, we could spend another 45 minutes easily talking about this topic, but I think there are a couple of themes that come out of this discussion today. One, it's imperative that you take more ownership of your health care, understanding your situation, preparing for those doctor's visits before you go in so that you can advocate for yourself. I think the other key message here is that it's important that we be consumers, seek out that second opinion, find out the impact of making a decision and not making a decision, and really setting those boundaries to make sure that you're focused on getting the best care possible and that it is possible to receive good quality medical care, but it's up to you to take a role in that. And I think the final message is there are resources out there. Dr. Gerda Maissel is certainly one of them in the service that she provides that can advocate for you or a loved one if you need that. And Gerda, before we wrap up this session, would you mind directing my listeners to your website and some of the other resources that you provide?
Sure. People are welcome to go to my website, which is www.mydadvisor.com. You can find me also on LinkedIn. I'm on Facebook as well, and you can reach out to me on LinkedIn and just send me a little note as to how you heard my name, and I'd be happy to connect with you. And then I post little things on LinkedIn on a regular basis, news articles, et cetera, that people may find interesting.
Well, Gerda, thanks so much for joining us tonight. A lot of great wisdom that you've shared, and I think you've opened up a few eyes with some of the things that you've shared in this episode tonight. So thank you.
Thank you. My pleasure.
And folks, thank you as well for joining us for yet another edition of the HR Kyle podcast. As I always say, and I mean it just as much, we appreciate you listening each week and being an active participant in this podcast, sharing your thoughts and ideas and feedback on our episodes. So know that we're very thankful for that. Otherwise, I'll leave you with this. Stay focused, stay grounded, and please stay tuned. Well, that's a wrap for today's episode of the HR Kyle podcast. We hope you found our discussion valuable and filled with insights that you can apply in your professional journey. Whether you're a business leader aiming to foster a thriving workplace or a job seeker looking to carve out your own path, remember that HR Kyle is the compass that can guide you towards success. If you enjoyed this episode, don't forget to subscribe, rate, and share it with your network. We're committed to being your trusted source for HR wisdom, and we look forward to having you back with us for our next episode. Remember, in the world of HR and professional growth, there's always room for progress. Be sure to visit our website at hrkyle.com. That's hrkyle.com to learn more about how we can help you meet your business and professional goals. So until next time, this is HR Kyle signing off. Stay motivated, stay informed, and keep reaching for those career goals. Music provided by bensound.com. That's bensound.com.